Hello everyone, welcome back to another one of my videos. I'm Dr. Sistare with Palm Beach Cosmetic Surgery, and today I get the opportunity to talk to you about the tummy tuck. The tummy tuck is a procedure that we utilize to flatten and strengthen the tissues of the abdomen. Through the course of life, things happen that cause the abdomen to stretch out. Whether you're a guy or a girl, you can gain a lot of weight or lose weight, and consequently the tissues around your belly are a little bit looser than they used to be. Or a common complaint is women who have undergone pregnancy and childbearing. The process of your belly expanding and contracting with the presence of the baby leave your tissues a little bit lax. So this gives us the opportunity to correct that laxity with a procedure called a tummy tuck. So we do this by making an incision along the lower aspect of your waist, and we then separate the fat overlying the muscle of your abdomen and create a flap. We pull that flap down to make it tight again. During that process, it gives us the opportunity to strengthen the abdominal wall muscles that might have separated a little bit during pregnancy. And once we've pulled the tissues down into their new position, we can excise any extra tissue and give you a nice flat belly that you used to have before life happened. There's different types of tummy tuck depending on the length of incision that we need to make in order to achieve your personal goals. There's a mini tummy tuck where the incision stays in between the two hip bones that you have on either side of your hips. Sometimes we need to extend that incision all the way out to the most lateral aspect of your waist. And in certain people, we need to start to bring that incision back, curving around behind you to get rid of the excess tissue on your love handles as well. Tummy tuck is often combined with liposuction to give you some contouring following removal of the excess tissue. It's not uncommon for both of these procedures to be done at the same time. If we need to remove a large amount of tissue with a large amount of fat with liposuction, in addition to a large amount of skin with the tummy tuck procedure itself, it's not uncommon that these procedures are separated into two procedures on 2 different days to give you the best outcome. Recovery is normally about 2 to 4 weeks. It depends on the person, depends on the degree to which you have skin removed. Most people wake up really, really tight the next morning, where they kind of have to bend over when they walk, and that tightness tends to loosen up over the 48 to 72 hours following surgery. It's a short-lived tightness that you feel. The goal is to make it overly tight to begin with, so by the time your skin relaxes, it's appropriately tight, and you don't look up and say, well, my skin is still loose, what did I even do this for? A common question that I get regarding tummy tucks is, what's going to happen to my belly button? Am I have a new belly button? Is it the same belly button but coming out of a different hole? So the way this works is the belly button itself stays in the same position. Your belly button is a fold of tissue that connects with your abdominal wall. So if you're looking at someone from the feet upwards, the skin of their belly comes together and kind of dives into their abdominal wall. That stalk stays in the same spot. But what we do is we release it from the skin that it's normally attached to, and when we pull down the tummy, when we tuck the tummy, we create a new hole for your belly button to exit. So it's the exact same belly button, it's just connected to different tissue. So it's going to be in the same spot. There are some potential complications from a tummy tuck, unlike similar to any other surgery, but the particular ones that people ask about for tummy tuck is normally it's an accumulation of fluid underneath your skin. This fluid can either be proteinaceous water called a seroma, or it can be a small accumulation of blood called a hematoma. Most of the time, this seroma or this hematoma goes away on its own. Occasionally, if it persists, it warrants sticking in a needle and sucking the fluid out so that it doesn't cause any problems. And then on rare occasion, it would warrant going back to the operating room and physically removing the fluid so that it doesn't distort the skin and distort the outcome that you're looking for. So, in a nutshell, that's a tummy tuck. I hope I answered any questions that you had. If you have any more questions, I invite you to come talk to me personally. Consults are free. I'm looking forward to the opportunity to sit down with you and discuss exactly what I can do for you to help you achieve your cosmetics goals. Once again, I'm Dr. Michael Sistare with Palm Beach Cosmetic Surgery. Thank you so much.